From the JAMA Network, this is JAMA Clinical Reviews, interviews and ideas about innovations in medicine, science, and clinical practice.
Hello, and welcome to our listeners around the world. I'm Dr. Kirsten Bibbins-Domingo, Editor-in-Chief of JAMA and the JAMA Network. I'm joined today by Dr. Janine Austin Clayton. She is the Associate Director for Research on Women's Health at the U.S. National Institutes of Health. She's also the Director of the Office of Research on Women's Health at the NIH. She's the lead author of a special communications published in JAMA, Recent Developments in Women's Health Research at the U.S. National Institutes of Health. Thank you for joining me here today, Janine.
I'm happy to be here. Thanks for having me.
Wonderful. So let's begin. Give us what you tell people. Why is women's health research important? Research on women's health. Why is this an important specific focus at the NIH?
Research on the health of women is critical to understanding human health. And science and research has shown us that being male or female, that sex as a biological variable and the factors that affect us as we live in society affect our health and our health outcomes. That's why it's so critical to pay attention to the specific needs of women, as well as understanding how they may be different from men, and incorporate and include women in studies, females in preclinical studies, and test whether study interventions work in women and in men, and whether they're safe in women and men. So in a nutshell, because we now know that sex matters at a very basic level, at a molecular level, at a genetic level, and that the combination of sex and gender, being a man or a woman, affect how we show up in society and how we receive care in our healthcare systems, it's absolutely critical to focus on the health of women as one of the major components of human health. And as you know, at NIH, at the National Institutes of Health, our goal is to turn discovery into health, and that's for everyone.
Yeah, I think what you've laid out very nicely in this answer and sort of in the piece as well is how important this is for the entire breadth of the NIH portfolio, from preclinical studies, discovery science, all the way through the efficacy, effectiveness types of studies and the outcome studies that are also part of the NIH portfolio. So one thing that becomes clear in what is outlined in the special communications is that this has been a focus of the NIH for quite some time, but it's also evolved over time. So give us a sense of how long the NIH has recognized the importance of sex as a biological variable and the importance of research into the health of women, and how that has evolved over time.
The health of women has been important for NIH for some time. I would say beginning in 1986, when NIH encouraged researchers to include women in clinical studies, that was perhaps one of the first touch points that we can point to. And then in 1991, NIH established guidelines specifically for including women and underrepresented racial and ethnic minority populations in clinical research, and that reflected the NIH Revitalization Act of 1993. I would say fast forward to 2015, when new policies came out about advancing rigor and reproducibility, where addressing relevant biological variables such as sex was included. And then in 2016, the landmark Sex as a Biological Variable policy required accounting for sex as a biological variable, or SABV, in vertebrate, animal, and human studies, and that single-sex studies needed to be justified appropriately would be the next big turning point there. But in 2017, another policy related to inclusion was advanced, and this is around individuals, including individuals of all ages. And we know that women do live longer than men, and people that are older happen to include more women than in men. So that policy, which affects everyone, also had an outsized impact on older women being included. So it's been for many years. Through a policy lens, we can see that NIH has put forward standards. I like to think of those as ways that we have raised the bar in terms of expectations for how the research needs to be thought about, conducted, performed, and reported so that the research can have its maximal impact. And of course, along the way, we've introduced new programs related to the health of women as well.
And so this is really a cross-cutting theme across the NIH, and it affects then all of the institutes within the NIH and the specific disease focus areas within those institutes.
Policies such as the inclusion policy and the sex as a biological variable policy apply to all 27 institutes and centers at NIH, which are each focused on their own institute or center specific aspects of the health of women. And so policies are a way that we knit that work across NIH and beyond to the applicants and grantees that receive NIH funding, where we have consistent standards around our expectations. That also shows that we are addressing women's health across all of the domains and spheres of influence in science that correspond to those 27 institutes and centers as well.
So it sounds like you've given a nice history. What more is there to be done? Where are the gaps that you see that should be areas of focus?
So, by including women in studies and by studying outcomes in women and men, and by accounting for sex as a biological variable in our animal models, in our preclinical studies, in our cell based studies, we've learned so much that sex matters. And because we've learned that, we do want to see enhanced reporting of results of studies by sex. We also want to see studies that think about how to account for sex as a biological variable as they consider the study design, their analysis plan, and their reporting. And so, because of science, because of new technologies where we're able to dissect the impact of a sex chromosome from the impact of a hormone, we now know so much more than we did before. So, there's a great opportunity for us to better understand just how sex or sex traits, whether that's chromosomal, hormonal, anatomic, or other, are affecting health outcomes, which will allow us to better understand everyone's outcome and would allow us to take information that we learn from preclinical studies of animal models of human disease and allow that information to inform our understanding of the clinical situation and be able to understand when that is relevant, clinically relevant for people, and when it's not.
Yeah, so much of what's happening at the NIH and through all of our biomedical enterprise is really seeing the impact of the great preclinical discovery science studies now having their application to human health. And what I hear you saying is the opportunity to see and make sure that we understand how differences by sex really yield outcomes that would be optimized for each sex is really a fundamental goal for the future.
It's an incredible opportunity. And I just want to give a couple of examples. For example, the NIH Genotype Tissue Expression Study, or GTEx study, looked at gene expression in males and females across 44 different tissues and found abundant examples of differences in gene expression across various tissues. That information is important to inform future studies. At a more proximal or closer to clinical impact is the MOTOR-PAC study. MOTOR-PAC stands for Molecular Transducers of Physical Activity Consortium.
Mm.
And here we're looking at the effect of exercise on specific tissues in older individuals, younger individuals, people that are more physically fit or not, men and women. And what was surprising was that there were sex differences found in muscle response to exercise, and that sex differences were different in different tissues. And so I've had several scientists say that that drove insight for them
Mhm.
into how sex can have these effects and how they may even be different in different tissues and organs, and how important it is to understand the molecular underpinnings of that effect, because that'll allow us to understand normal physiology, which of course helps us to illuminate the many pathways that we see in terms of abnormal physiology and pathology and disease.
Sounds like there's much left still to do. And I know that this has been a focus for the current administration in terms of women's health priorities. Given the long history of this type of research at the NIH, I assume this is something we hope and expect will continue even with the change in administration.
It has been really remarkable to see such a federal focus on women's health research. And I think that the most comprehensive set of executive actions ever taken by Executive Order 14120, advancing women's health research and innovation, have shown the huge potential for accelerating and expanding impact. 19 constituent agencies in that initiative. We recently hosted a workshop at the White House on NIH interdisciplinary women's health research, where we highlighted how important and impactful it can be to harness interdisciplinary approaches and combine that with innovation to improve the health for all women across the lifespan. I do think that landmark changes like the first ever Women's Health Research Notice of Special Interest, NOSI, it's OD 24079. It sounds kind of generic, but let me tell you, this first of its kind funding opportunity links across every single funding institute and center
Wow.
at NIH, links to virtually all of the parent standing funding opportunities in research and training, identifies more than 175 women's health research priority topics that the institutes have said are on their radar is important for them, and even links to the small business innovation and tech transfer omnibus funding opportunity that we do with CDC and FDA, spurring innovation and identifying and expanding pathways for people to apply for women's health research, which we hope and fully expect that will lead to more people doing this type of research and more attention to these issues, but just as importantly, more benefit and more translation into clinical impact and innovation here in the United States.
Well, thank you so much. It's been such a pleasure hearing directly from you about the important work at the NIH on research in women's health. And I encourage everyone to look at the special communications, recent developments in women's health research at the U.S. National Institutes of Health. Thank you. I've been speaking with Dr. Janine Austin Clayton, the U.S. NIH Associate Director for Research on Women's Health and Director of the Office of Research on Women's Health. Thank you very much.
Thank you.
I'm Dr. Kirsten Bibbins-Domingo, Editor-in-Chief of JAMA and the JAMA Network. You can find a link to the article in this episode's description. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Daniel Morrow at the JAMA Network. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.